Madam Speaker, I rise today to share with you a story of a resident of Boulder, Colorado, who asked that I share her story on the floor of the House of Representatives. And Barbara lives in Boulder, Colorado, but she might as well live in Fresno, California, or Houston, Texas, or Las Vegas, Nevada. When Barbara was diagnosed with breast cancer, her private insurance plan said they wouldn't cover treatment because they maintained that the cancer was caused by fibrocystic breasts, which they claimed was a pre-existing condition. Now, Barbara didn't believe that for a moment, and her doctor backed her up, and her doctor wrote a letter to the insurance company and saying, no, this was breast cancer. It wasn't because of some pre-existing condition. Barbara had to call the Colorado State Division of Insurance, and they called Golden Rule, who was the insurer, and all of a sudden Golden Rule yielded a little bit and said, well, we'll cover the surgery on the affected breast, but not a bilateral mastectomy. Well, it took more calls, more fighting. She got some support from the State Division of Insurance. Finally, they found that the health insurance company agreed to pay for the bilateral mastectomy and breast reconstruction. Barbara's now covered by Medicare plus a private insurance supplement, and Barbara says it's the best insurance she's ever had at way less a price than she ever had to pay. She can go to any doctor she wants to get the treatment or that she needs. And Barbara asks, why wouldn't the under 65 group be delighted with the ability to have the same kind of insurance coverage? When you hear about a public option, what you are hearing about is the ability to buy into Medicare early. Now, it's not exactly Medicare, but it's a Medicare-like program under the version of the public option, the robust public option, which I support. It'll look very much like the Medicare system. It's pegged to Medicare. So this will enable people who are self-employed, work for small businesses, to participate in the exchange and say, you know what, I'm 62, I'm 59, I'm going to buy into Medicare early. My premiums will go to Medicare. I'll have the provider network of Medicare. Many people on Medicare are happy with Medicare. Now, again, no one's always happy with their insurer, be it public or private, but when I had 22 town hall meetings during the recent recess, and I asked every group, I said, you know, Medicare might not be perfect, but aren't we happy that there is a Medicare? Where would we be if our country didn't have Medicare at all? I think we'll be asking the same question 10 or 20 years down the road. Where would we be if we didn't have the public option? What a great way to provide real competition for insurance companies and allow people access to a Medicare-like program at a younger age. Thank you, Madam Speaker.